Good morning, everybody. Thank you for joining us. My name is Brad Woodhouse with Protect Our Care. I'm really thrilled to be, well, not thrilled about the content, but thrilled to be doing this event today ahead of the 1 year anniversary of RFK Jr.'s confirmation, which is Friday, which is not a cause for celebration at all. But I'm really pleased to be co-hosting this event with 314 Action, which helps focus on science and scientists and getting them into public office. So there's a fact-based and science-based response and undergirding of the issues that we're going to talk about today instead of wild conspiracy theories. So I really appreciate their work. We've been partners with them all the way through. And we really got a great panel today. We actually have Senator Ron Wyden, Ezekiel Emanuel, who I think everyone knows, Shaughnessy Naughton with 314 Action, which I mentioned will be joined later by Representative and Dr. Kim Schrier of Washington State, and Georges Benjamin, with Executive Director of the American Public Health Association, which we are partnering with on all of this work. I'll just say, and Senator Wyden knows this, and Representative Schrier, who we were shoulder to shoulder with, and 314 Action, we really warned about all of this. I mean, every single thing that's happened, we talked about. In 1 year, RFK Jr.'s made America sicker. He's let measles get a foothold in the U.S. again. He continues to undermine the efficacy of the measles vaccine. He's undermined public trust in vaccine. He's promoted dangerous conspiracy theories. He's installed quacks in key positions, wreaked havoc on our nation's public health infrastructure. I mean, look, the idea that this charlatan would make America healthy again is BS, and it always was. And during the battle over his confirmation, we warned about everything that he would do, about what he would do with the vaccine schedule, about how he would undermine vaccines, about how he would undermine public health, about how he would install conspiracy theorists in key position, how he would run off experts. And for some reason, he said he wouldn't do any of those things. And Senator Cassidy bought it, and Senator Collins bought it, and Senator Murkowski bought it, and enough Republicans bought his BS, that they confirmed him and then allowed him to do what he's done. And now, Senator Cassidy will hem and haw about the actions that, and some other senators that voted for his confirmation will hem and haw about, what he's doing and what he's doing with vaccines and what he's doing with measles, conspiracy theories and everything else. And now we, of course, know that he lied in his testimony about what his role was in undermining vaccines, and Samoa taking it, his organization at the time, and him taking advantage of a tragedy there. That story came out yesterday. And now, they don't want to say that they regret voting for him, but they hem and they haw. And, they should really bow their heads in shame, because this was predicted by people like our very first speaker, the great senator, the ranking member, former chairman, and I think obviously future chairman of the Senate Finance Committee, Senator Ron Wyden.
Brad, thank you. And thank you for protecting our care and constantly being a grassroots juggernaut for standing up for people without power and clout in our healthcare system. And the way I'm going to start it is by quoting Robert Kennedy word for word. And a year ago today, here's what he said. He will do nothing, quote, that makes it difficult or discourages people from taking vaccines. That statement, we say today, was a complete and total lie. The overwhelming evidence cataloged by Protect Our Care, the investigators that we have on the Finance Committee and others said that was a false promise that Robert Kennedy made a year ago. His strategy was basically to say anything he possibly could come up with that would get him confirmed. These bogus answers about what happened in Samoa, they lent credibility to an anti-vaccine crusade that preceded a deadly measles outbreak. 83 people were killed, mostly kids, and thousands were sickened. As Brad said, we're getting continuously more and more information based on communications and documents from public officials about what really went on in Samoa. Robert Kennedy was there for one major reason, and that's to push anti-vaccine views. He came to the Finance Committee. I was the chairman. He lied to my face when I asked him about it in the committee. If he's willing to lie to me about something that is so easily proven, what else is he lying to Americans about? Since coming to office, again and again, he's betrayed the public interest. He purged the public health system of anybody who disagrees with his anti-vaccine ideology. The consequences of all those purges and the people who have real or perceived differences of opinion is bad for science, bad for public health, and really bad for America. All of this comes on top of the fact that Republicans have taken a sledgehammer to the healthcare system. They have made the biggest cuts in the history of our country. Hospitals closing, laying off some staff, canceling services lines like labor and delivery care. My office actually releases a monthly casualty report on all the damage Republican cuts are doing to American healthcare. And you can see the consequences everywhere. States are wrestling with impossible choices now. In effect, filling in the healthcare hole or cutting other essentials like public safety. Robert Kennedy has been an enabler, and he's been a bystander for all of these cuts, as well as Republicans' continued allegiance to Big Pharma. So we're going to keep watching Robert Kennedy and the Trump administration, and we will keep documenting the harm they are causing American families. We're going to work every day to turn the tide and actually produce solutions that help the American people. We're going after, for example, middlemen. Comes to close to half of the $5 trillion that we're spending on American healthcare. That's the kind of thing we're doing to help people. And thanks today to Protect Our Care and 314 and all the wonderful advocates. And this is a great group of folks you put together. And I look forward to hearing everybody and getting to questions.
Senator Wyden, thank you, and thank you for your leadership, and thank you for mentioning the scope of the damage that President Trump and RFK Jr. and Republicans have visited on healthcare. They're getting, the public health policies are getting people sicker on one side, and now on the other side they have less coverage, more expensive coverage, and the Medicaid cuts are reducing their choices for providers and hospitals. It is really an assault on healthcare across the board. With that, I want to turn it over to Dr. Ezekiel Emanuel. I think folks recognize him. He's a regular contributor on all types of media and social media. He's an advocate. He's a bioethicist. He's an oncologist. He's the vice provost for global initiatives and the Diane S. Levy and Robert M. Levy University professor at the University of Pennsylvania. And I think the part of your biography that I enjoy the most is Dr. Emanuel is the most widely cited bioethicist in history. So I don't think we could have a better representative to speak about what's going on now in public health than Dr. Emanuel. Zeke?
Mute. Thank you, Brad, and thank you, Senator, for your statement. I am the child of a pediatrician who dedicated his life to making children healthier and better. He led the campaign in the 1960s in Chicago to get lead paint out of apartment buildings. I'm very proud of him. That's one of the reasons I became a doctor. Unfortunately, in the last year, RFK Jr. has made America demonstrably less healthy through an avalanche of misinformation, fear, uncertainty, and doubt. He has undermined the trust in the scientific basis for government decisions and policies. He's politicized decisions, and he's made substantial cuts on a political basis. This is all going to come back. It has already made us less healthy. It is actually going to make us less healthy for years and decades to come, and the damage will be done. We should remember the first thing he did was to hollow out the workforce at HHS, to cut 19,000 people who have left in 2025, either because they've been fired or forced to resign. You cannot run an agency for 330 million people, which covers 20% of the GDP on 62,000 people. Just impossible. We can take a look at the NIH, which everyone in America has faith in. Cut 1,200 jobs. Over half of the institutes and centers do not have permanent directors, so they don't have a strategic vision and they don't go forward. There were cuts to lots of programs at the NIH, including mRNA vaccines, even for cancer. Cuts to grants for cancer doctors and research, cuts to Alzheimer's, cuts to diabetes research. There was no vision of progress in the most important diseases affecting us, but cuts. The FDA experienced 3,500 cuts in jobs, politicized decisions through the National Priority Review Program that said basically the FDA commissioner is going to decide which drugs get fast-tracked and reviewed quickly based upon their agreement with national priorities. Not the way to go. And of course, he has devastated the CDC in oh so many ways. 25 to 33% of the workers have been fired, closing multitude of centers, Center for Chronic Disease Prevention, Global Health Centers, multiple surveillance agencies, the Forecasting Institute to monitor the world for any potential threats to United States health, the National Institutes for Occupational Diseases that monitors workplaces, and he has packed the advisory boards like the Advisory Committee on Immunization Practices, the Autism Coordinating Committee, with people who have no credible qualifications but are politically aligned with his vision. He's also prevented many of these committees from working. The United States Preventative Services Task Force, two meetings that happened in July and November, canceled or postponed. Those are critical for making recommendations to Americans about cancer screenings and many other preventative measures, whether they have data and what are important. Canceled 79 advisory committees and 23 remain inactive. He's also packed another committee, which is very under the radar but so important, the Vaccine Injury Compensation Program, so he can adjust what counts as an injury from vaccines. The game plan is to add autism so that it bankrupts the Vaccine Compensation Committee, so companies get out of vaccine production. And we have seen the effect. Just the threat has forced Moderna to get out of vaccine production for infectious diseases. That is going to make all of us less healthy as we go forward. As we all know, we have had a major an avalanche of misinformation and fear surrounding the measles vaccine. That has been a disaster. Last year, we had 2,276 cases of measles in the United States, a dramatic hundredfold increase. This year, we are only 6 weeks in. We are projected to have 8,500 cases in 2026 of measles. We've had 3 deaths last year. The last death before that was a decade before, single death in 2015. And with 8,500 cases, who knows? The measles vaccine is a miracle. Before, we had hundreds of thousands, up to 750,000 cases of measles a year, and it plummeted to basically under 100 after the introduction of the vaccine in 1963. We had tens of thousands of hospitalizations, and those plummeted as well with the introduction of the vaccine. But we are going to have much more measles. We already have 10 states below 90% immunization. Measles is going to spread throughout the country. The latest outbreak in South Carolina, where 95% of the people experiencing measles were unvaccinated, is going to continue. It's not only measles. That's been a focus of many people, but there are other vaccines. The hepatitis B vaccine at birth given that prevents liver disease, liver failure, and the need for a liver transplant or death, that has been discouraged and fear surrounding it by RFK Jr. The consequence is people years and decades from now will die because of that vaccine. Diphtheria, a disease we thought was gone, zero, out. The vaccine rates have dropped from 95% just a few years ago to 92% in 2025. We are going to see a resurgence of this terrible vaccine for children. And part of the campaign, many states, 6 states now have rolled back requirements to have vaccines to start school. We are going to see outbreaks. Mississippi, Louisiana, Idaho, Florida, really bad problems. We also need to be clear. This whole issue extends well beyond the vaccine, CDC, NIH. Just Friday, the Center for Strategic and International Studies released a report, bipartisan report with people from both Republican and Democratic Party saying that we have regressed in the last year on our biopreparedness from any threat from overseas. We have less capacity to do surveillance. We have less capacity for supply chains for the various things we might need, whether they're masks or drugs. We have problems with producing vaccines or drugs. And the government cut all the funding for mRNA vaccine development that is going to threaten us. You cannot develop a vaccine against a potential biohazard in months like we did with COVID unless you have mRNA. And that we've hollowed out because of RFK Jr. Let me end with two things. One is Trump RX. This has been touted as a real triumph. Mostly, I think it's just fuzzy math and no real benefit to the American public. There are 43 drugs on Trump RX. You have to purchase them with cash without insurance. President Trump championed the fact that we were reducing the prices on Wegovy and all those GLP-1 drugs down to $199 per month. That actually works out to $2,400. Most Americans cannot afford $2,400 a year on one drug. More importantly, more than half of the drugs on Trump RX are actually cheaper, not going through Trump RX, but getting them through Good RX or Mark Cuban's cost plus drug program because they're generics and you can get them cheaper on generics. So he's cutting brand names when there's already a cheaper alternative. Trump RX is a lot of fuzzy math and not actually all that beneficial for the American public. It is not changing your drug bill. Let me end by stating an important positive that has happened. And we have seen, I think, the very important positive around food by RFK Jr. It is the single or one of two bright spots under his regime. That is this emphasis on cutting back on ultra-processed food, cutting back on sugar, salt, and eating more plant proteins. In general, it's a very good program, and I thought the ad at the Super Bowl was actually a positive sign. It's not completely good because he's emphasizing more red meat, which we know causes heart disease and early deaths. He's emphasizing not eating seed oils, which is not a good thing. But in general, reducing ultra-processed foods is a positive for the American public, and eating more fruits and vegetables also necessary. The second area, as I just published yesterday, the Center for Medicare and Medicaid Services that runs Medicare and Medicaid has, in general, under Dr. Oz, done a reasonably good job of actually trying to promote American healthcare and trying to develop new programs that will increase the value and control costs. Those are two bright spots. We know that the Trump administration can do good in the healthcare space because of these two bright spots. But in general, they have made healthcare more politicized. They have made it less science-based, and that threatens the health and well-being of Americans. Unfortunately, I think my father would be very disappointed if he were alive today at the threat to America's children and making them less healthy, not more healthy.
Thank you. Thank you so much, Dr. Emanuel. With that, I would like to turn it over to Shaughnessy Naughton. She's the president and founder of 314 Action. She is out there promoting good public health, promoting good science, promoting candidates and office holders who believe in good science. And she is, if I'm right, a chemist herself. So with that, I'd like to turn it over to you, Shaughnessy.
Well, thank you, Brad, and thank you, Senator and Dr. Emanuel, for getting on this morning. My name is Shaughnessy Naughton. I am the founder and president of 314 Action, the only organization working to elect scientists and doctors and public health officials to public office. And frankly, our mission couldn't be more critical than right now. As Brad mentioned, before I founded 314 Action, I was an infectious disease researcher. I worked on trying to create new antibiotics, and that is a field of research that has been terribly underfunded and only gotten worse under this secretary. As we reflect on the first year of office under the Trump administration and RFK Jr., there's not a whole lot to give us hope. By dismantling research funding in this country, they are undermining our ability to succeed in the future. Part of why we're living through this biotech revolution is because of the investments we've made over the last 80 years in research and education that have provided tremendous advancements in health and medicine. 80 years ago, cancer was essentially a death sentence, and now we have cancer that we can cure or maintain, as well as vaccines that even can prevent cancer. And all of that is being undermined by a health secretary that frankly doesn't believe anything that conflicts with his pseudoscience views on health and science. And we have seen that demonstrated in the undermining of the vaccine schedule for children, that the confusion and chaos that he's caused for a lot of parents just trying to keep their children safe. And the false hope that he's given to many people by, declaring things like we're going to know what the cause of autism is by September. This is not just, this is no longer just a man operating under his name. This is the Health Secretary of the United States, and that's doing tremendous damage to the health and welfare of the American people. And we see it most obviously in the unprecedented, generation level of measles cases that we've seen under his watch. Part of what the senator had asked in the confirmation hearing what were RFK Jr.'s ties, financial ties to the anti-vaccine industry that he has, frankly, profited off of for decades. And, we are still calling on him to clarify what, if any, financial advantages he has by continuing this pursuit of undermining vaccine safety and vaccine use in this country. And it's also why we launched RFK Watch at 314 Action, to hold this secretary accountable and to expose him as the most dangerous Health and Human Services Secretary in history. RFK Jr. is a liability to the Republican Party, and we are going to hold every elected official who supports him accountable. And that is why we are working with doctors and scientists at all levels of government, from city council and school boards to the state legislature and the federal level, to elect more scientists and physicians and health professionals that can stand up to this administration and this secretary and hold them accountable and keep Americans safe. And so I thank you for giving me an opportunity to speak today, and look forward to the questions.
All right, great. Thank you. Let me mention as it relates to questions. We have a lot of folks on this call. We have activists, we have, advocates. We are only going to take questions from the press, and because we do have so many people, we're going to take those in the chat. So if you have questions for our panelists and you're a member of the press, just write your question in the chat, mention your outlet, and we will read those out. So who they're directed to, what the question is in your outlet, press only. With that, I want to turn it over to Dr. Georgia C. Benjamin. Dr. Benjamin is the executive director for the American Public Health Association. He is a doctor, as I mentioned, in his own right, doctor of internal medicine. He's served in tremendous number of positions that have been responsible for promoting public health, and American Public Health Association, true partner with Protect Our Care and our Public Health Watch. And so I'm so glad to turn it over to you, Dr. Benjamin.
All right, thank you very, very much. And I really hate the fact that a year later we're having to do this. I've been in this town a long time, and I've never felt the need that to speak out so strongly on a cabinet official. Let me start by just reminding us we told you so. Mr. Kennedy's tenure can best be described as chaotic, broken promises, administrative incompetence, professional neglect, which is a strong term when you think of him as an attorney, public health malpractice, bad science, disinformation, exclusion of expert advice, and he's made less transparency and avoided public input in many of the things that they've done. Now he wants to bring these failed activities and affordability over the next year. He was at the Heritage Foundation just yesterday, laying out what he's going to do over the next year. And in fact, his actions so far this year have made things less transparent, more costly, and lethal. People are sicker and are dying sooner because of his policy and programmatic decisions. In my mind, he's failed in his key role as the nation's chief health official, running the nation's top public health agency. He's really, in many ways, improved himself to be an incompetent manager. Far too often, he doesn't even know what's going on in his own agency. He clearly has undermined the morale of his employees. He's lost the trust not only of his workers, but many surveys have shown that he's losing the trust of the American people, not only in just vaccines, but in other areas as well. On a recent Kaiser Family Foundation survey, even 25% of Republicans say they don't trust him. And the proof is, of course, he tells us we should not trust him as well. Many of the things he's done have been irrational, just irrational actions of personnel, funding cuts that kind of come and go. On Monday, they announce a funding cut. On Tuesday, they recognize they screwed up and they have to pull it back. And I just got to tell you, from a health perspective, this puts the public's health at extraordinary risk. The CDC, which is the nation's top prevention agency, of course, in many ways has become dysfunctional because of many of the things that they do. People there are even afraid to do the best science that they know how to do. The FDA, which regulates 20 cents out of every dollar the United States spends on consumers, is every day increasingly become more dysfunctional. And clearly, the research enterprise in the United States, which certainly was the best in the world, is falling rapidly behind other nations, despite the fact that Congress has held the line on funding cuts, but they've destroyed much of the well thought through infrastructure that we have to ensure that we get the best science out of the National Institutes of Health. I think many of the things you've heard today, of course, demonstrate his clear incompetence. And just let me reiterate, we told you so. Thank you.
Great. Thank you. And we were supposed to be, and I think we may be joined by Representative Schrier, who is a representative from Washington State. She's also a pediatrician, has been in the fight with us. Do we have?
He's here.
He's on, Brad.
Okay. All right. I'd like to turn it over to you, Representative Schrier, Kim Schrier.
Thank you, Brad. I appreciate it. I'm glad to be with you. And thank you for inviting me and for all that all of you are doing to stand up against this administration's attacks on our public health. I'm Kim Schrier, a member of Congress from Washington's 8th Congressional District. I am also the first pediatrician in Congress. And a year ago, prior to RFK Jr.'s confirmation, I was really proud to join 314 Action and call out how dangerous it would be for our nation's health, especially for our children, if RFK Jr. were to be confirmed as Secretary of HHS. And tragically, he has been just as destructive, if not more so, than we had worried. In just a year, he has done unparalleled damage to our nation's public health. And this is nothing new for RFK Jr. For years, he has peddled misinformation and baseless conspiracy theories about the safety and efficacy of vaccines. And I just want to set the record straight here. Immunizations were one of the greatest advances in the 20th century, and they have saved millions of lives, including here in the United States. They are safe and they are effective. And as a pediatrician, I am so thankful that children, for the most part, no longer suffer from vaccine-preventable diseases like polio and measles and meningitis. But RFK Jr. and his anti-vax influencers now have a platform, and they are eroding public trust in immunization and raising doubts where there should be none. And I saw this in my practice over 20 years as a practicing pediatrician. More nervous parents, more questions, desires to split up vaccines or have a slower schedule. And I answered those questions so patiently and reassured parents and built trust and got kids immunized. But I just want to be clear, those concerns just don't pop out of nowhere. They were directly linked to the sort of propaganda that has been spewed by RFK Jr. and his allies. And now, as HHS Secretary, RFK Jr. has real power, and he has used his office to elevate and empower conspiracy theorists to make national public health decisions. We saw this in full effect last June when RFK Jr. fired every member of the Advisory Committee on Immunization Practices, or ACIP. It is hard to overstate the importance of ACIP. This is a committee whose recommendations have guided our nation's vaccination policy for over 60 years. And as a pediatrician, I have relied always on ACIP because I've known that I could always count on its members to deeply consider scientific data and make sound, informed, thoughtful recommendations. In response to this mass firing, I led 86 of my colleagues, including every Democratic doctor in Congress, in demanding that he reinstate all 17 members to ACIP and uphold his oath to the American people to protect our health. But he has continued to take us down a dangerous path by packing the committee with a whole bunch of new members, many of whom wear their anti-vax ideology like a badge of honor. And since their very first meeting, they have made clear that they are incompetent and unqualified for this important job. They're already making reckless changes to our nation's vaccination policy. And so now, as a pediatrician, I am worried that children will be growing up in a world that is more dangerous, that children will suffer from preventable illnesses, and that they will die preventable deaths. And I've treated patients with measles and with meningitis and with pertussis. And let me tell you, these are terrible, life-threatening illnesses, and we should be so grateful that they have become rare. Kids with measles, they're miserable. They have high fevers and they can suffer long-term brain damage. And you already know they can get pneumonia and die because we've seen deaths already this year in our country. Kids with pertussis, they cough so hard, they vomit and they break ribs and they cough for 100 days. And little babies who get pertussis or whooping cough, they just stop breathing. Babies with meningitis, they're these babies who come in with fevers and they're floppy and you don't know what's going on. And it used to be so common for us to do blood tests and urine tests and spinal taps on these babies with fevers. And now, thanks to vaccinations, it is rare. But all of that is going to change if RFK Jr. gets his way. I mean, Those are just three of the serious diseases that vaccinations protect children from. And this newly formed ACIP has already made big changes to the standard childhood vaccine schedule. And I am so fearful that this committee is going to continue to go further, and soon measles and pertussis and meningitis and polio and other preventable illnesses are once again going to gain a foothold in this country, and children are going to needlessly and tragically get sick and die. We're already seeing this as we face the largest outbreak of measles in decades. Pertussis is on the rise all over this country. And on top of this, RFK Jr.'s handpicked ACIP has made dangerous changes to the hepatitis B vaccine recommendation that will put newborns at risk for chronic hepatitis B and early illness, liver cancer, and death. And I am so worried that because of the ill-informed changes to the COVID-19 vaccine recommendations for pregnant women, now we're going to see women and their babies at high risk. Last year, I had the opportunity to question RFK Jr. in committee, and I made it clear to him that I will lay responsibility for every death from a vaccine-preventable illness at his feet, and I will hold him accountable. And at times like this, we just really need voices of reason and common sense who will continue to speak to the public, with the public, and who will continue to hold this administration accountable. And I just want you to know that I will continue to fight in Congress on behalf of our children and our nation's public health. And I will stand up against RFK Jr. wherever and whenever necessary. And I will fight this administration's dangerous attacks on science and our health. Thanks for having me.
Brad, it's Ron, and I'm going to have to go, but just one thing that
Yes, please.
one of our speakers made that is such an important point. RFK is up to his eyeballs in conflicts of interest. For example, he is part of an anti-vaccine lawsuit. He handed his role in the case to a family, so Robert Kennedy's family profits over the lawsuit. A conflict of interest, a major one. That's not the kind of person who should be in this position. I believe he ought to resign. I'm sorry, I'm going to have to run. I've got lots of stuff. Bad manners. Thank you.
Well, Senator, thank you. No, we appreciate you. We appreciate you being here. And let me thank you, Congresswoman Schrier, Dr. Schrier. Thank you for joining this call, and thank you for all of your leadership. So I guess I misspoke, and I see people figured this out. But reporters that are on the call could place their questions in the Q&A function in Zoom, not in the chat, which is disabled. So if there are, and I know we have some questions already, I'm going to call on my colleague Jeremy Funk, which is part of the public health, who is part of the Public Health Watch team, to read out the questions that we have.
Yes, thanks, Brad. This is Jeremy. Yes, we already have a number of questions in the queue. Let's just go in order here. First up, from Cheryl Gay Stolberg from the New York Times. Brad, this question is for you. Republicans and Kennedy have framed themselves as the party of healthy eating and are going to use that aspect of their MAHA agenda to woo Democrats and independents in the midterms. How are Democrats and health advocates like you going to counter that?
Well, first of all, I think that if you look, let's just talk politics here for a minute, writ large. I mean, I think if you look at the evidence in the political realm, and you look at the most recent elections, you look at the off-year elections, you look at the special elections, I think one shiny object, and maybe a good shiny object, but one shiny object on food is not going to overcome the environment that Republicans are facing right now. Now, the environment could be different. I also think the larger healthcare issues, and we're talking about public health today, but the healthcare issue that RFK Jr. has been part of, and certainly Trump and Republicans, that has really dominated the discussion over the last 4, 5, 6 months, are the issue of Republicans ripping away the tax credits that people rely on to get access to healthcare. This is a rolling disaster. Look, those tax credits were ended, and they helped fund tax breaks for billionaires, just like the $1 trillion in cuts to Medicaid. And that happened in the exact same bill. They cut Medicaid by $1 trillion. We're tracking at Protect Our Care 750 providers, these are hospitals and clinics and Planned Parenthood clinics that are at risk of closing or having portions closed, emergency room closed here, a maternity ward closing there. And so I think the overwhelming evidence is that the public trusts Democrats more than Trump and Republicans on the issue of healthcare, all the issues of healthcare. And I don't think fireside chats about the food pyramid are going to overcome the disaster that the American people see that Republicans have caused in healthcare. Dr. Benjamin?
Yeah, people should eat better and they should exercise more. No question about that. But they can't afford it if their food costs too much. They can't afford it if the communities aren't safe. They can walk through their communities. They can't deal with eating better if you can't walk out your house without being grabbed by ICE. So I think that Democrats ought to stay on message about the terrible things this administration is doing that makes their life more dangerous. And you have to be alive in order to be able, and free in order to be able to eat those healthy foods. And I remind you that the president himself certainly does not eat healthy.
That is for sure. All right, Jeremy.
Well, I understand that Shaughnessy may have a
Oh, I'm
additional
sorry. Go ahead,
comment on that.
Sure. Yeah, I mean, I would just add that, this is not new that Democrats have talked about healthier lifestyles and eating, particularly around children. It was a big part of Michelle Obama's platform as First Lady, let's move. And the Republicans at the time treated it like it was this snowflakey, wokey nonsense that should be ridiculed rather than embraced. So I don't think anybody in this call doesn't want to see better health for Americans, but you don't get that by taking away food assistance for children, by cutting off Medicaid for our most vulnerable seniors and children, for failing to extend tax rebates for the Affordable Care Act so people can actually afford the health insurance that helps to keep them and their families safe and healthy. So I think we have to be very clear in what it is that they are promoting. And they are promoting a chaotic, unhealthy America that has people not knowing which way to even look for what's coming next from this administration.
Great. Thank you. And Jeremy, I think there are a few questions in here that might require some expertise that I'm not.
Yes. For instance, this one from Melody Schreiber, The Guardian. I'd like to hear about the possibility of changing the VICP, which is folks know as the Vaccine Injury Compensation Program. Do any of our experts have a thought on that?
Dr. Emanuel?
You're muted, Zeke.
Sorry. We've written about this. Here is the major issue confronting the country. We have a vaccine compensation program, and the vaccine compensation program is able to compensate people who think they've been injured without going to court and without a lengthy, uncertain lawsuit, and a lot of the money going to lawyers. The issue is on what injuries do they compensate people? And one of the goals of this surreptitious goals of trying to get autism back on the agenda as a consequence of vaccines is to say, well, you can now compensate if you have been vaccinated and got autism. That will bankrupt the injury program. And the consequence will be that manufacturers will have to be on the hook for any injury that might be related to vaccination, and they will leave the vaccine business. You have to understand the vaccine business is a very, very low margin business because we sell them at very low cost. The reason people stay in the business is there had been guaranteed demand for every new case and for the recommendations made by the ACIP as well as the United States Preventive Services Task Force. The moment that demand becomes uncertain and goes away, vaccine manufacturers are going to get out of the business. They're going to get out of the research business, especially if they slow up review of the vaccines, and we've already seen them talking about having to have review of every new flu vaccine, which couldn't possibly not just review clinical trials, making them super expensive and also delayed. So they're creating this sludge in the system that will make it very difficult for manufacturers to stay in business. And the ACIP, as you have seen, is going along. They're saying, well, we're not going to mandate polio vaccine. So who would produce a polio vaccine again? May be difficult to get. We're not going to mandate hepatitis B. So parents are going to have to be more active. And not every parent is paying attention. Right after they did the hepatitis B and they rolled back the 18 vaccines for children, I got a call from my kids. What should we do? Yeah, my kids are very educated. They have access to an expert. They can call their dad. But most Americans aren't like that. And just the uncertainty, and the doctor might be uncertain as well, whether they're going to get in trouble, whether they're going to be paid for it, etc. And you are going to see the immunization rate go down. We're already seeing it. And there's only one direction, as Shaughnessy has said. That means infections are going up. More people are more kids are going to get diseases that they are totally preventable, be hospitalized, and some unfortunately will die. And that's the tragedy of this vaccine policy by this administration. I will also say one thing. I have spoken to President Trump about this, and Secretary RFK Jr. is running wild, as the president put it, because the president agrees.
Wow. Thank you so much, Dr. Emanuel. Jeremy, if no one else wants to get in on that, we'll go to the next question. Jeremy?
Yes, we got the next question is from an NPR affiliate in Buffalo, New York. I'm wondering if the panelists could speak more about the recent IACC appointees. Autistic advocates have been outspoken with their concerns with these appointees. What are the panelists' perspectives on the new IACC appointees and what their goals may be? And as folks know, that's the Interagency Autism Coordinating Committee.
Dr. Emanuel or any others?
I don't know the exact qualifications, but there's been a lot of criticism that they hold the same views about vaccines and autism, and that they are advocates of scientific of therapies and interventions that are not scientifically based. And that's been a major theme of the appointments to advisory committee members. There are people who aren't science-based and making recommendations of unproven treatments.
Great.
I mean, just to,
Yep, go ahead.
I saw that the chair of that committee, when asked why she was asked to join, said she had no idea.
Wow. Well, that's pretty telling. And look, I think one of the things, and we talked about this during the effort to stop RFK Jr.'s confirmation, going back to his days and the group that he founded that is virulently anti-vaccine and has tried to associate the measles vaccines with autism, was that he has shamelessly taken advantage of vulnerable families and vulnerable parents who are looking anywhere for an explanation, looking anywhere for a solution. And for him, maybe to this day, but certainly while he was head of that organization that he founded, it was really a grift. It was really a grift of vulnerable, parents that were in a really emotional state. He's exploited parents on this issue for the entire time he's been involved in it. Jeremy, do we have more questions?
Yes, they continue to pour in. The next one, the interesting one from the Hill. One criticism made against Kennedy is that his rhetoric at times veers into eugenicist talking points. What do you make of these accusations?
Yeah, the concept that this is survival of the fittest, and that if you eat better and exercise more and do certain things, you will therefore be able to survive an assault by a virus or bacteria or another health threat. And that is eugenics because that is not true. It is true that healthier people do better when hit with a health threat. But the truth of the matter is that unvaccinated, healthy people get extraordinarily sick from these infectious diseases. And public health went through this, 60 years ago. And we learned that eugenics is bad policy, bad science, and unethical.
Yeah, look, I don't know what his RFK Jr.'s beliefs on eugenics are, but the idea that you don't need vaccines, you don't need modern medicine to fight off infections, whether viral infections or bacterial infections, is just wrong. Over history, we know plenty of people who have died from infections. Lincoln's children, among others, who were plenty healthy, had plenty of nutrition, had a lot of outdoor activity, and still died from things like diphtheria or smallpox or polio. It's hard to believe that there was anyone more healthy than Franklin Roosevelt, who came down with polio and became paralyzed from it. So that notion that the best way to protect yourself is, just be healthy and live a healthy life, and you won't get these deadly diseases, is just plain factually incorrect. We know the best way to prevent deaths are by vaccines. I think Shaughnessy alluded to this, but just to put a number on it, almost 100 million people have been saved from measles deaths since the introduction of the vaccine in 1963 worldwide. 100 million people. That just tells you how effective the vaccines are.
Great, thank you. And I think in the interest of time, we're going to take one more question and then we're going to wrap.
Yes. Okay. This one's from Jessica Cairns at Inside Health Policy. Wondering if you have any comment on AMA and the Vaccine Integrity Project's announcement today that they will conduct an independent vaccine review ahead of the next respiratory virus season.
Look, why are they doing that? Right? Why is Mike Osterholm and the people up at the Vaccine Integrity Project doing this? Because our government under RFK Jr. at the head of HHS and the CDC have abdicated this review ahead of the next respiratory season, right? They are filling a void that the government created because it's not doing a scientifically based analysis of impending infections. It's just that simple. This is a testament to the problems we've had over the last year.
Great, thank you. Shaughnessy or Dr.
I agree. I agree.
Yeah, I would just add, and I mean, the doctors know this better than probably any of us, but with a good flu vaccine, we still lose 30, 40,000 Americans a year. If we don't, I mean, think about what happens if we have none. And I think that is a threat when you have a health secretary that is so hostile to evidence and science that has been proven and thinks his gut feeling is a better indicator of where to go with public health.
Great, thank you. Well, look, I want to thank all of our panelists. I want to thank our reporters and other participants that got on the call. I want to thank 314 Action for co-hosting this, and Dr. Benjamin, I want to thank you. I mean, what you all do in this partnership that we've begun to have, and between Protect Our Care and your organization, and then Dr. Emanuel, of course, thank you. And I know Congresswoman Schrier and Senator Wyden had to get on to other things. There are a couple questions in the chat, particularly Karen Rubin, if you're still on the call. We have a couple fact sheets on both of the issues that you raised on prescription drugs and on women's health. We'll get those over to you. But I would just say from our perspective, we have to remain vigilant. I mean, if other voices have to be out there promoting the efficacy of vaccines because this administration won't, we have to do it. If we're seeing more destruction of public health infrastructure, we have to call that out, and we really have to hold members accountable that particularly I'll just say it in Senator Cassidy's case, who put his reelection campaign above the health of the American people, and he didn't wind up getting Trump's endorsement anyway. So it was, for his perspective, it was all for naught, but it has really done great damage, confusion, and destruction to public health, in this country. So this anniversary is on Friday. Like I said, it's not a cause for celebration, but we will continue to convene calls like this to put a spotlight on what's going on. And again, I want to thank everybody for joining us, our panelists, reporters, advocates, activists, and I hope everybody has a great day. Thanks, everybody.